Good evening, everyone, and welcome to tonight's webinar from the Center for Global Health Equity. My name is Nancy Love. I'm the Borchert and Glisson Collegiate Professor of Civil and Environmental Engineering. My work centers at the intersection of water infrastructure, environmental quality, and public health. My group approaches these topics using current methods in molecular biology, analytical chemistry, and engineering design. The center is supported by a visionary gift provided by Dr. Tashi and Leslie Yamada. The goal of this gift is to propel the work of the center toward having a transformative impact in global health using methods grounded in core values that reflect respectful collaboration, cultural humility, collective learning, intentionality, transparency, and accountability, all in a cross-disciplinary framework that will result in a positive impact on health equity. Tonight's session is on climate vulnerability and health. This is the third challenge topic webinar this semester. The other two challenge groups that presented previously were focused on data science and global health and empowering women in communities. The goal of the webinar series is to gather input on concepts being developed within the challenge groups and to use that input to shape the planning for the center's activities. So for tonight's event, we'll begin with an introduction on how we are approaching the efforts to date around climate vulnerability and health. That will be followed by 4 speakers, each talking for about 8 minutes, who will speak about their own work and experiences at intersections between disciplines and core elements that we envision being key to this challenge area. We will spend the last section of the webinar on Q&A. And so when we do that, we'll ask you if you have a question or a comment to raise your digital hand, and that should be through a little hand at the bottom of your webpage, or in the participant button, you'll have an access to a raised hand. And when your turn comes up, we'll call on you when we want you to ask your question. We ask when we do that you please turn your camera on if you have one so that people can see you. Especially in this time of COVID, we think that we're having fewer and fewer opportunities to get to meet each other. And this is a way for people participating in the webinar to see who's asking the question. Without further ado, I'll pass it to Dr. Joe Eisenberg from the School of Public Health. Joe?
Yeah, thank you, Nancy. So my name is Joe Eisenberg. I'm the John G. Searle Endowed Chair and Professor of the Department of Epidemiology. I'm an infectious disease epidemiologist, and my research is at the intersection of theoretical analysis using transmission models and empirical data collection analysis through field studies. I have a large research platform in Ecuador focused on studies looking at the impact of changes in the social and natural environments on vector and waterborne diseases. So I'd like to spend the first few minutes here sort of setting the stage for our panelists, who will then speak on the data gaps they see in addressing climate vulnerability and global health. So in exploring ways in which the center can have maximal impact, we have coalesced around this idea of building a surveillance infrastructure. We can start with the next first slide. Yeah, so integral towards addressing the data gaps that exist in thinking about climate vulnerability and in general environment and health is having a surveillance infrastructure that can collect data in a variety of sectors. So the first being contextual variables such as demographics, socioeconomic status, social capital, public-private service provisions. The next being our environmental measurements, including climate and containments and different ways in which we can characterize the environment that ultimately impacts our health outcomes, which is our third area of data. And importantly, in this context that we see that not only do we see the sort of linear progression of these contextual variables impacting environment, and then those impacting health outcomes. But we also see this as a systems level phenomenon in which the environmental factors and health outcomes then feedback and affect our contextual variables. So we envision this platform as a way to address some of the gaps by focusing on collecting data in these core areas and also focusing on the interaction amongst these at multiple scales, both spatial and temporal. Another big area in which we want to focus on in building this infrastructure, which is shown on the next slide, is we want to strengthen our partnerships within the countries that we exist. And by the initial phase in strengthening our partnership is to develop and strengthen the within country skills in a variety of areas, including engaged scholarship, design and data collection analysis, communication, critical thinking, and then also deployment of and demonstration of surveillance technology and strategies. So this is our initial step in actually providing and developing a true partnership. And our second phase of that would be, in the next slide, creating collaborative networks amongst our peer peer institutions, both through student and faculty engagement that is sustained over time, and importantly is something that we feed back and learn from these different kinds of network models and in an iterative and adaptive way. And so on the next slide really shows some of the core data areas, and many of these areas that our panelists who are experts in different aspects of this will speak to. Importantly, bridging the gaps not only within these core areas, but also across these core areas, and not only at any given scale, but across scales, both spatial and temporal. And so with that, I'd like to introduce our first panelist. Dr. Pam Jagger is Associate Professor at the School for Environmental Sustainability. Trained as an applied political economist, her research focuses on the dynamics of poverty and environmental interaction in low-income countries. She's a director of the National Science Foundation funded Energy Poverty Peer in Southern Africa, a 5-year collaborative program to support research and training on the topic of energy access and its implication for health, well-being, and the environment in Southern Africa. Dr. Jagger has worked as a policy research scholar in the World Bank, with the World Bank, Resource for the Future, the International Food Policy Research Institute, and the Center for International Forestry Research. So Pam.
Great, thanks, Joe. Good evening, everybody. I think if we can advance to the next slide, great. Okay, so I just want to provide a little bit of the motivation for our thinking about establishing surveillance infrastructure as a really strategic pathway forward for the center. We have really good and current evidence, both from the Global Burden of Disease study and then also from the Lancet Commission on Planetary Health, that environmental health burden is actually increasing and becoming a much bigger factor in terms of non-communicable disease burden in particular. And of course, we have a growing evidence base that suggests that climate change is going to have tremendous health burden going forward. And actually, a lot of analysis has been done to show that mitigating climate change right now will really pay off in terms of averting the potential health burden that will come to fruition in the not too distant future for people in both high income and low income settings. So this, from my perspective, environmental health, climate change, these are understudied, becoming more important, really sort of critical issues that we need to be paying close attention to. Of course, environment is identified as one of the social determinants of health. So sits nicely in terms of thinking about issues of equity and how to advance that agenda. What we know based upon our sort of collective experience is that health, people that work on health and people that work on environment are seldom really well integrated. We know that from our academic interactions. And then certainly if you start thinking about the list of key stakeholders, including government ministries, non-governmental organizations, and civil society, we have lots of examples of people really focused on health, people really focused on environment, but not a lot of cross-fertilization across those two groups. So I think we're arguing here that there's really an opportunity and a need to fill a gap. And one of the really fruitful ways that we can do that as largely members of the academic community can be to contribute to thinking about not only creating data and tools for analyzing problems, but figuring out how to put those data from health and from environment and from demographic and socioeconomic systems together in a very powerful way. Next slide, please. So we've done a little bit of thinking about some what I would call sort of core principles that would guide a population health and environment surveillance effort. And they include thinking about really identifying critical sites in the places that many of us work where there's either high climate or high environmental health burden or both, sort of creating an opportunity to meet a significant need for providing really state-of-the-art information and architecture for doing research and policy engagement. We can imagine there being a fairly high-level set of guiding research questions, but then lots of room for lots of people to engage in different ways, and I'll speak to that in just a minute. I think we have really coalesced around this idea that repeated measures at appropriate intervals are really critical to understanding dynamics and change. And we're thinking, we need health data for different health endpoints collected at different intervals. Data on climate and environment, ranging from deforestation to temperature fluctuations. They sort of have their own appropriate intervals to be thinking about. But we're really interested in this idea of building state-of-the-art infrastructure for collecting data over time and in the most appropriate way for addressing the questions that we're interested in. We have some more sort of specific ideas about what are critical elements of building such an infrastructure, and they're elaborated there. And some of you who attended a recent meeting got a bit more of an in-depth look at some of the thinking. But a good example is to think about the extreme power of georeferencing data across health data systems, demographic data systems, and environmental data systems, with the georeference being the sort of one of the tools that connects all the dots for us across these different data types and across different scales. And then as Joe mentioned, there's really a big interest in Michigan being a key player and a central node in building capacity and systems for learning. And hopefully with the idea that, we're just sort of behind the scenes facilitator of all of this, rather than, walking into places and announcing that we're here and this is how things are going to be done. So that's very much the spirit of thinking about some of these ideas. Next slide, please. So just to give a sense of how big the tent can be, and I think, all of us have different interests in terms of our environmental focus, and a lot of us have different interests in terms of health outcomes. So you can imagine potential thematic areas for this type of a surveillance system to be many, and for there to be lots of opportunities for people to sort of find ways to engage. And so what I've done here is just enumerated some of the key environment issues. So of course, climate change is a big and ever increasingly important one. Lots of work to be done on water and sanitation and air pollution in low and middle income country settings. You know, there's a long history of WASH research and activities, and a shorter history looking at air pollution exposures in low income countries, but there's still just a tremendous amount of work to be done. Same story on the nutrition front, even though there have been tremendous gains made in terms of addressing undernutrition. There's still lots of room for improvement, and COVID actually probably is going to set us back a little bit on the successes that have been realized there. And then I'll just flag urbanization and migration and their relationship to health as also really interesting and under researched areas where putting into place a really effective demographic surveillance system that gives attention to how people are moving, where they are on the rural to urban continuum, is an opportunity for us to make some really nice contributions. Next slide, please. Okay, so I just want to close with two sort of specific examples to give you a sense, maybe give you a little bit more of a concrete sense of what we're talking about. So I think what I'm arguing is two things. One is that we have the potential to develop a surveillance system that really could provide a platform for basic science, but also for implementation science research that would help us understand how effective different types of interventions could be. Climate adaptation could be water and sanitation interventions, anything across the board, but really understanding what the impacts of those types of interventions are and what the potential is for scale up. And the photograph that I have here is from an NIH funded study that we've been working on in Rwanda for the past 5 years, focused on household air pollution. And you know what you see here, so we had fielded an extremely detailed demographic socioeconomic survey. We visited people's households and had them wear exposure monitoring equipment to get a sense of their particulate matter and carbon monoxide exposures, both personally. This study respondent is wearing monitors. And then we also have a monitor set up in the background in her kitchen. And then we have, in addition to this, a suite of data related to deforestation and forest degradation, and how heavy reliance on the forest resources that people are using, which they're burning in their cooking stoves and causing the greenhouse gas emissions and the household air pollution exposures, how that is linked to this whole sort of household cooking energy system. So this has really allowed us to bring together stakeholders from that are working on climate change, stakeholders that are working on land use change, stakeholders that are working in health, and really getting them to think in a more comprehensive way about this particular problem of household air pollution exposure, which is actually the primary or the leading cause of morbidity and mortality in Rwanda right now. So #1 above everything else. To the next slide. So this is just another example of how we could leverage the architecture that we're talking about. When we have either covariate or idiosyncratic shocks to systems, and this is very common in places where people are vulnerable to climate change, if we have good data systems in place, then we can really start to understand what the impact of those shocks are on people. So we've had an ongoing study in southern Malawi for the past 4 years, And during the time of our data collection, part of the study area was hit extremely hard by the cyclones that affected Mozambique and Malawi and Zimbabwe in March of 2019. So that presented an opportunity for us not only to really understand what the conditions were for people before the cyclone hit, but how they were affected by the cyclone and what sort of coping strategies they had. So we're working right now with meteorologists, with remote sensing people, analyzing socioeconomic data, and assessing all sorts of impacts and coping strategies from that perspective. So it really can be quite powerful in terms of providing information quickly to policymakers and other key stakeholders about what's going on in an area. So I think that's it for me, Joe.
Thank you. So our next panelist is Dr. Marie ONeill. Marie is an epidemiologist and professor at the School of Public Health who's worked in Mexico at the National Institute of Public Health and the National Center for Environmental Health. Her research has addressed health effects of air pollution and temperature extremes, climate change and health, and occupational and environmental equity. Current collaborations include community-based participatory research study in Detroit on climate-related exposures, housing and health, and a study of environmental and dietary influences on birth outcomes among pregnant women in Mexico City. Marie?
Thank you. Next slide, please. So I'm very happy to be on this panel, and I wanted to provide a concrete example of one of the areas in which we can collaborate globally, and that is specifically addressing the issue of climate change, heat exposure, and health. So we know that heat waves are increasing in their frequency, intensity, and duration, and we're already seeing very important health impacts, both heat-related deaths as well as illness, including among outdoor agricultural and other kinds of workers. And we know that these health impacts are unequal both within communities and across broader groups and across nations and states. So as an epidemiologist, I have enjoyed being involved in research that is relevant to policies that range from regulation of environmental contaminants to collaborating with urban planners to think about how can we structure our cities and to enhance health and be climate friendly. And there's also a chance for this kind of research to identify priority populations for intervention, the most vulnerable populations. The solutions to some of the problems that we document in climate change, heat, and health include both adaptation, because we know the climate has changed and we need to invest in infrastructure to protect our population and prevent problems, as well as societal choices that mitigate greenhouse gases and provide co-benefits to health and well-being of people who live in our communities. Next slide, please. So one example of a climate-friendly solution that I think illustrates this point is green spaces. That there is evidence that they can be both health protective and climate friendly. And on this slide, I have a definition of green spaces that's effectively vegetated areas that can be detected with both remote sensing and other methods, ground observation, as well as with other techniques. And there is evidence that green spaces can be beneficial to our health. They provide opportunities, as in the park pictured here, to increase physical activity, reduce stress, anxiety, and depression. There's also opportunities when people congregate in green space, that there's stronger social cohesion. And there's also evidence that trees and other kinds of vegetation can dampen noise. Shade can reduce heat exposure, as well as mitigate the urban heat island effect, where paved over surfaces and buildings accumulate heat and radiate it at night. And also vegetation can reduce air pollution levels, air pollution exposures. Next slide, please. So as an example of a collaboration that I'm involved in, where data on climate and some of these societal friendly policies are combined with health, is a study that's led by Daniel Rodriguez at Berkeley, funded by the Wellcome Trust. And it's on green spaces, air pollution, and climate-related heat mortality in Latin American cities. And this is a study of around 300 cities in Latin America. And as in many fields, we don't see as much research in South America or in Africa, in part because of lack of research funding, and exactly to the point that Pam made, issues with data availability. There's also known to be a large green space deficit in Latin American cities, so not as much green space as one would hope for promoting health and well-being. Next slide, please. So as I mentioned, this project that I'm engaged in is exemplifying the need to integrate and bridge gaps across the diverse sources of data. So one of the challenges is to measure heat and estimate heat exposure to people living in these cities. Also, we're interested in projecting how future climate change may impact health burdens. We also need to estimate exposure to effect modifiers, green space being one of them, that you can glean data from satellite imagery. Then you have to apply epidemiologic methods to understand how heat impacts mortality in these multiple Latin American cities, and the data have been obtained over various different time periods. And then once all those data are integrated and modeled, you want to compute excess mortality per year by age, for example, or education per location. And I think there should be another figure on this slide, maybe try to advance it. Yes, okay. So this is an example of an exposure response function where the y-axis is the mortality risk as you look on the continuum of hotter days, hotter exposure estimated by the climate and weather data. And next figure. So the modeling enables us to look at how maybe this response function may be lowered if there are changes made in urban areas to increase the quantity of green spaces. And then one more. And then even the blue one is thinking about distributing the green spaces into areas where it can be most beneficial for health. Next slide, please. So I want to shift gears a bit and touch on some of the concepts that we've been discussing and thinking about with respect to this center. What does it mean to have equitable partnerships with our global health colleagues? And Joe mentioned, strengthening within country skills, as well as creating collaborative networks as being two of the important goals. I also wanted to highlight an opinion piece I just read the other day about this term capacity building. One of my colleagues in public health wrote in an opinion piece talking about, in a way, we could think of it as capacity sharing, because we can certainly look at examples with the COVID-19 pandemic where there are countries who have done a way better job in containing the pandemic than we have. And these are not necessarily only the highest resource countries with the kind of traditionally defined best capacity. So I think that's one of the things that this center is going to be about, is to support equitable partnerships. And our group has been talking about what that means. Next slide. So I just wanted to show this diagram because I think it's relevant to the Center for Global Health Equity. Is how involved do we have our community, the affected communities, maybe the places most impacted by climate change and environmental health problems. And you can really have this continuum where the investigator says, I want to study this, I'll get the data from the country, and there's very little community involvement, all the way to community-driven research, where it's the people in country, for example, or in several countries that say, this is what we need to change the status quo, which is not beneficial. So this is one of the ways of thinking about how we partner and the degree to which we can partner. No one right way necessarily, but it is something that we're thinking hard about as we continue to develop some ideas. Next slide. And I want to mention some of the principles of one of these methods that is, as Joe mentioned, I'm engaged in a project in Detroit where we apply these principles, where we're working with community members who are of the community, the affected community, as equal partners. We are working on co-learning, capacity building across both the academic and the the community partners. I think this can also be applied to all different disciplines. And we're looking at the determinants of health that are relevant for a local standpoint. And the idea is to promote a long-term process and commitment. And I think the work, for example, in Ghana that colleagues in the medical school and nursing school and elsewhere have been engaged in for many years is sort of another example of a long-standing commitment to working with people from that country to improve health and well-being. So with that, I will conclude my remarks. Thank you very much.
Thanks, Marie. Our third speaker is Branko Kerkez. Branko Kerkez is an associate professor of civil and environmental engineering. His research interests include water, data, and sensors. His group is working to enable autonomous water systems which adapt themselves to changing conditions using real-time data and controls. His team has demonstrated immense impact with these technologies. Pardon me, my screen just took away my notes. In as close as Detroit, where they've worked on pardon me, there we go, where their data-driven approach showed the city how it could save $500 million in its stormwater collection system. That was billion with a B. He also works internationally on collaborative cross-disciplinary teams to evaluate use of these same approaches in low and middle income countries. So with that, I hand it over to Branko.
Thanks, Nancy. Hey, everybody, thanks so much for the invite. So my goal in the next couple of minutes is going to be to talk about sensors, but I'll use that word very broadly, even though my group works primarily on technologies like that. So I think that's best illustrated here through just a project that we've been working on. And so we're going to take a look at Mexico City. I think a lot of you know it's a very, very big city with lots of people. By official estimates, somewhere between 8 to 9 million people, but that's official, right? Like the numbers, depending on who you talk to, quite different. And when you have a city with lots of different people, there's lots of challenges. And one of those challenges revolves around water and water access, in particular with stressors like climate change and population growth. So if we go to the next slide, just kind of show you that people in Mexico City have a very different relationship with water than we do. There's there's a large part of distrust in water, which is one of the things that the team is studying. But when you don't trust the water, you get it where you can. So that might be buying it at the store. It might be getting it delivered by somebody who you trust. It might be hauling it from far away from the source that you trust. Or if you live in a fancy part of the city where they have a Ferrari dealership, maybe your experience with water is completely different and maybe slightly more similar to what we experience here potentially. So anyway, water is a large chunk of people's lives there, maybe much more so in terms of day-to-day activities than what we're used to. And the person that's been looking at this for a very long time, next slide please, is Liz Roberts, who assembled our team. So she's a professor in anthropology here. And I learned from her what anthropology was naively, and I learned a lot from her. It was really great. And she's been doing a lot of work in Mexico City over the years, just spending time with families and neighborhoods and really studying people, which, for me as an engineer, like I make things, I do things, like the idea that we build them for people was always there, but like to actually spend time with people was like a very novel concept. And what Liz did is he basically brought together a team to take a look at water in Mexico City. And the next slide is going to show you like who's on that team. There's lots of people. So rather than naming names, I'll just show you the various disciplines, but they included public health, obviously anthropology and all the methods that come with that, and then engineering. And basically brought us together and said, look, there's Mexico City, there's water, things going on, let's work on it together. And to be frank, like it took a while to figure out how we all mesh together. I think a lot of us are used to working with different disciplines, but for me, it was always like two at a time, bringing together a large subset and working together. But it's kind of tricky to figure out what kind of framework you use to think about that. Obviously, we all share a passion for water, but what does that mean? Like, is there a discipline of water that includes all these different things? Not necessarily. And the thing that we kind of settled on, or it had in discussion, was what kind of framework can we use as a team to kind of look at this? And that's what the next slide is going to show, is basically this idea that, water is a way that people are exposed to things, right? That's either in the water or they're exposed to the water itself, et cetera. And there's a whole field of study dedicated to it, namely exposure science, which was a lesson that I had to learn as well. It was like, exposure science is this field that looks at, how people are exposed to things effectively. I'm an engineer, so I'm just kind of like paraphrasing here. But the idea was that under this umbrella, public health and anthropology and engineering really had a shared framework to kind of look at this problem. And the thing I'll sort of say here is, the way I view it is, we build sensors to measure exposure. And again, I'm not talking about sensors, like I teach a class on sensors, which means building devices like widgets that measure things. I'm speaking very sort of loosely here in terms of methods that can measure things. And in particular, the thing that we're going to measure is exposure. So if we go to the next slide, it kind of shows you how all these various disciplines come together to measure exposure. So from a public health perspective, obviously you're spending time with people, you're measuring their health, right? Like, so their blood, urine, hair samples, you name it. You're visiting families and collecting information on how their use of water manifests itself in their health. From an anthropology perspective, you're spending time really talking to people, like visiting them in their homes. Again, that was an amazing thing to learn as an engineer. They can spend time with people and talk to them and learn what they want. I know that like we should know better, but like I learned that, and it's changed my own research fundamentally. And obviously the engineers brought in measurement tools as well, like measuring water quality and all sorts of other things. So anyway, the team coming together is taking a really close look at various neighborhoods in Mexico City to try to figure out how they experience water and the various things they're exposed to through the water. If we go to the next slide, one of the things that became pretty apparent early on was the idea that water is a very dynamic process there. And I mean that in the sense that people use water in very different ways, and water comes in different parts of the day, or the week. So here we're used to just turning on the tap and everything works. In Mexico City, that might work in some neighborhoods, but by and large, water comes and goes. In some cases, you might get a daily, in some cases, you might get a weekly, and people become very resourceful about how they store that water. And what we realized is that the way that people interact with water has just a pretty wild temporal dynamic to it. So it varies across the city and it varies across time. So when you're conducting experiments, you're trying to study something, are you going to be there when the water is actually there, or are you just going to visit when it's not there? And that makes a big difference with how you sort of carry out your experiments. So the thing that we try to think of was, how can we measure such a dynamic system? And if we go to the next slide, what we'll basically see is this idea that we're already doing that in our own homes. And there's a very big similarity, whether you're in Mexico City or you're in Ann Arbor, or even as we've seen if we're in Ethiopia with a project that Nancy and I are working on. There's one common thread, which is actually cell phones and Wi-Fi work really well. And so the idea is, or in large part, at least the places we've seen, can we bring these kind of technologies that are in our home and, quite frankly, surveilling us? I know that's the word that was being used earlier, like surveillance. These technologies in our homes are actually surveilling us. Can we use these same technologies to to add new methods for scientific study, right? Rather than doing actual surveillance and selling data on people, can we collect relevant data? And so if we go to the next slide, that's what we did. We took these technologies that are in your smart thermostat at home, and we embedded them in effectively like a water sensor. And so what you see here, my slide earlier had a slightly different background color, so we're missing a couple of things. But basically what we built is it's almost like a cyber infrastructure, if you want to think about it. It's a device that contains a number of measurement, like basically sensors. And so they measure every kind of physical water parameter you might be interested in. And if we go to the next slide, what that'll show you is how we package everything. So what we do is we basically build, I don't know, something that looks like a shoebox. And inside that shoebox is a lot of technology that we've put together. And that technology goes under your sink. And so if we go to the next slide, I'll show you an example of in Ann Arbor, or actually here in Mexico City. We connect these to people's homes and they give us a real-time insight what's happening, right? They send us information about when water is used, what the quality of the water is, how available it is, et cetera. And we work with homeowners to connect these devices either through cellular phones or in Wi-Fi in a lot of cases, to start providing us with new kind of insights about what's happening in these systems. And so you can see like we're taking these kind of technologies that are actually embedded in a lot of modern homes and putting them in the field. And if we go to the next slide, what I'll show you is basically what it's measuring is actual exposure at the tap level. So water quality, for those of you who study it, you know that that's measured very sparsely, both across space and across time. So here in the US, you know, you get a few snapshots maybe in a month if you're lucky about what the water quality is. With a device like this, not only are we just measuring water quality in the city, but we're measuring it at the tap where people are using it. And that data feeds back in real time for analysis. And we can see what's going on, but more so than that, we can guide the experiment, which is really the interesting part. So if we go to the next slide, what we did is we deployed these throughout Mexico City. That's the example I'm showing you now. We actually have a bunch of these in Ann Arbor as well. And all those dots that you see on the map are real-time water quality sensors that are measuring at a really fine resolution, something on the order of, it takes a measurement once every 10 minutes or so. And we take that data then in real time, and we try to infer what's actually happening in the system. So if we go to the next slide, this is what you get. And so I know we're sitting at Zoom and you're probably wondering, like, what's he showing us, some sort of data? That's really not the point of it. The point I'm trying to make here is when you collect a lot of data, that's what you get. You're going to get a bunch of data and you got to figure out what to do with that. And so the technologies are really just an enabling mechanism to collect that data. To actually convert it into information is a completely different thing. And that's actually a lot of times what our lab group does. So a lot of you probably heard terms like big data, machine learning, and all these different things. Those are just fancy names for math. And we use math to analyze this data to actually extract information out of it. The main thing this picture conveys is just how basically dense this data set is and how much information we're getting. And there's lots of gaps in that data. And the reason why there's gaps is because there's not water during those times. And so what we're able to see in this data set is actually, as soon as the water arrives and hits that household, we start measuring it. And when it leaves, we know that as well. And so we can infer all these patterns that we would have otherwise missed because we wouldn't have been in the field. And so that's what this data allows us to do. And so what we've been working on, I'll just show this in the last slide here, are basically like we're riffing off of these technologies and trying to figure out how to create sort of novel experimental tools for measuring, let's say, exposure. So this is an example that Nancy and I are working on. It's this idea of, if you've ever, whoever has a pool out here, have seen how people maintain their own pools. You take these little chlorine test strips and you dip them in the water and you try to figure out what your pH is, for example. What we're looking at is, could you hand these kind of strips to homeowners? They could dip it in the water themselves and then use a cell phone to basically take a photo of it. That gets sent to us and we send back in real time an answer to this is the let's say the quality of the water. But what we're actually doing is we're creating a whole data backend to collect all this information. So the whole idea behind sensors and all these other things is even if you have to do lots of field work, there's a way to sort of like make sure that you're collecting the data when it's most interesting, even if you can't be there yourself. So anyway, yeah, that's the kind of the summary of the stuff I wanted to show. Thank you.
Terrific, Branko, thank you. And our fourth speaker before our question and answer session is Durga Ghimire. So Durga is a research professor in Michigan's Population Studies Center and an adjunct professor at the Agriculture and Forestry University in Nepal. He's also the executive director at the Institute for Social and Environmental Research in Nepal. He is a social demographer who studies the interplay between social, political, economic, and familial changes, psychological and emotional stress, population mobility, and environmental dynamics. And I think one of the reasons we wanted to have Durga talk to us also is thinking about how do you take these kinds of systems, data surveillance, the kind of information we have, and connect that maybe even to translate it into kind of sustained policies. So without further ado, Durga, take it away.
Good evening, everybody. As Nancy said, this evening I would like to share some of our experience about surveillance system that we have been using in Chiton Valley family study in Nepal. It's a small valley, and we have been doing studying that valley for a long time. I will use CBFS as an acronym for Chiton Valley family study. As I speak, I know several of you are already aware of CBFS. It's a 25-year-long panel that features over 10,000 individual interviews with full life histories, including international migrant interviews and continuous measurement of community change across 7 decades. Next slide, please. CBFS was initially designed with 2 interlinked goals. First goal was to assess the impact of rapidly deteriorating mountain environment on population dynamics. And the second goal was to assess the impact of rapidly changing social and ecological context on demographic processes. Given our time constraint, I will not go into the detailed sampling here, but I would like to draw your attention on two spatial distribution of our population and ecological sample. If you look at the map, you will see those blue triangles that are our population sample, like a community. We have 151 communities. And then those red squares are our botanical sample plots. So from this sampling design, you can guess, like and all of these are geo-referenced. Like we have the GPS coordinates, and you can link the data from population or the community as well as from the botanical plots. So you can see that those green areas are forest areas, including one of the famous Chiton National Park. And then the other gray area is our residential area, which is our sample area, study area for population dynamics. Next, I will describe, we have both the demographic surveillance and ecological surveillance, but today I will just focus on the demographic surveillance part. The form on the right is our first instrument on collecting the surveillance that we use at the beginning. In this, you can see, it has a serial number, respondent ID, age, sex, and their, living arrangement, marital status, and those kind of things. And the trained interviewer goes to each household, sample household, and update those records on a monthly basis. We have been using this instrument for a long time, because at that point in time there were no no laptops or electronic media. In 2014, we transitioned to a highly sophisticated computer-assisted telephone interviewing system. And I would like to highlight a couple of dynamics features of this system that could be relevant to other settings. First, this system not only allows us to update the demographic events such as living arrangement, including migrant destination. As I said earlier, we have been tracking migrants all over the world, and this system allows us to, record their destination place, marriage, pregnancy, birth, death, and school enrollment. But at the same time, it also allows us to record the relationship among the family members. Second, if there is any change in the household member status, for example, an unmarried person got married during this time period, the system generates a supplementary instrument for a personal interview. So if some unmarried person gets married, the instrument generates a supplement survey instrument, and we interview that person for the detailed measures of marriage. So each event, marriage, birth, if a mother gave a birth to a child, then we interview her, and we call it birth set, and we record the children's healthy status and other measures. Third, as shown in the lower picture, the second picture, as shown in the lower picture, once the interview is complete, the interviewer complete the interview and click send and receive button. Both the pair data and interview data are securely transferred to a server at Service Research Operation here in Ann Arbor. Those data are transferred to server here, which can be simultaneously accessed by both the data analyst and study manager in Nepal as well as in the US, allowing us tremendous control over standardization of the data collection process and data quality and availability of the data on time data availability. Because we have this system in place, we have been able to continue collecting this demographic data throughout this pandemic. We did not have to stop because the system was already in the place. So what this means, it generates a lot of data. Next slide, please. So as I said, in addition to demographic surveillance, we also have repeated measures of household resource and energy consumption. Initially we started with the face-to-face interview. Now we are, moving to telephone interview, and we can collect it even during the pandemic. Child health, direct measurement, and parental interview. In this case, we have to be physically present because we are going to measure, taking a blood sample, so that is direct observation. Likewise, we collected mental health with DNA, reproductive health, and healthcare facility use, both face-to-face and telephone interview. Fourth, we also collected land use, like how the land use in those specific neighborhood or our community sample had been changed. Because the list is going to be too long, I did not add the botanical and other data that we have been collecting throughout this period. So to utilize this uniquely detailed data, to generate uniquely detailed, high quality data to answer high scientific questions as we have been talking, we adopted a three-pronged, next slide please, three-pronged, closely interlinked working strategy that involves, as indicated above, like if you have to do the research in an efficient way, we need to have these three components together. Research without capacity building, we would not be that efficient. Without policy feedback, would not be efficient. So our working approach is to go to bring this three interlinked strategy together. So to do that, next slide, please. We have established for capacity building. We have several activity we have been doing. That is in-house training here in Ann Arbor, there in Chittagong, and long distance training. This one is a long distance training. Professor Axin is training on survey data analysis course in Nepal. And we can use this facility to train people in other South Asian country or in other region. So that is a capacity building part. On the policy part, we launched a policy communication fellowship, and those fellows prepare these policy briefs through the interaction with policymakers. So these policy briefs are circulated or provided to the policymakers in the respective countries, and this one is for Nepal. I think I should stop here.
Okay, thank you, Durga. Well, and thanks to all our speakers. At this point in time, we're going to open the floor for questions and discussion. Let me just remind you that to ask a question, please raise your electronic hand. Again, I think it's on the bottom for you. I have a different screen, but under participants, if you don't see it immediately, you should be able to click on participants and then raise your hand. Then either Joe or I will call on you when we're ready for you to ask your question. And if you have a video, we ask you to turn your video camera on so that we can see you. Okay, so with that, I think I want to, as we wait for questions and hands to go up, I want to see, Joe, do you want to start the question and answering with our panelists?
Sure. Maybe just start with Dirgha, since you were our last speaker, and really nicely describing some of the essential components of an infrastructure to collect important data in this sphere. I guess the question I have is sort of how do you ensure that the quality of the data that comes out of these surveillance systems?
Exactly, that's the point. Once we when we were in a paper pencil face-to-face format, we have a system of putting one supervisor for 5 interviewer or data collector, so that we have a very intensive monitoring and supervision of the data collection. And then each questionnaire was data entered twice by 2 different people and then matched together. And if there is any inconsistency, because we had this ongoing system, our interviewer or field or the supervisor could check on the respondent. This is the beauty of panel, but I don't think it will be feasible for cross-sectional studies. But for us, we have that luxury. In terms of CAPI or computer assisted interviewing, it is even better, because once the interviewer clicks the button in his laptop, the data appears in a server here in Ann Arbor. And we can look at the data, including how many times the interviewer hit which key, the key stroke in the laptop, and how long it took to answer one question, whether there is anything wrong going on or suspicious about that. That's why we have 2 people in the picture. If you look at one is a data analyst, he is mostly focusing on the data part, and the other person, the study manager, she is primarily responsible for quality control and giving feedback to the interviewer or the data collection team. That's how we have been doing it, and that has been very effective. Yeah.
I might suggest that we also ask Bronco to comment on that question, because I think he's undoubtedly had to deal with data quality, and I guess sometimes you need just good enough data quality, but how do you draw that line? How do you find that?
Yeah, I mean, that's a question that we get actually a good amount of time, is like, hey, got these new devices and widgets and you're doing this, how do you make sure it's good? So the official and the true answer is we do our best to quality control it and use domain knowledge to double check that the data is correct. And we have all these quality control procedures, which are really long. Like, I'm more than happy to forward those manuals. My simple answer to that question is we're measuring things that have actually not been measured before. And like, that's just what that is. And there's data. If you don't want to use it, don't use it. But actually it's been the other way around, is people want access to it and they're okay with it being noisy sometimes. They're okay being, it being however it is sometimes, because it offers a glimpse into something that hasn't been measured at that resolution before. So in many ways, it's kind of like, that's kind of my view on it is, we do a lot of work too for government agencies and other people, and the ideas of like, is it government quality? Well, it's like, it's not there to begin with. So it's not like take it or leave it, but it's there. And usually that kind of helps out the conversation. The data usually speak for themselves because people can take a look and based on their field of study can very quickly see if it's good or not. And I think what it boils down to is it useful? And that's kind of what we focus on. We find that no matter how cheap a measurement is or how maybe it's not the most advanced one, it's still useful. And it's just about getting that utility out of it. So anyway.
I think though, Nancy, if I can just add, a really key issue is the repeated measures dimension of this thing, right? And like the data that Bronco's talking about, where he's got every 10 minutes, this sort of input coming in. I mean, we all understand statistics, right? Like the more measures you have on the same unit, the smaller the confidence interval. So it really, this is a very powerful, much more powerful than a sort of cross-sectional study or one or two visits to a place.
Yeah. And Pam, I think kind of in line with that, thinking about kind of sensor data as one kind of data, thinking about other core building blocks of types of data. You talked about georeferencing being a really helpful common thread amongst different data sets. What are other kinds of core data types that you think we need to, build or have available to build this kind of surveillance system?
So I think on the health side, there would be sort of a core set of measures that we might be interested in investing in. Dry blood spots are one example where that's a biomarker that you can do a surprising amount with, and it's it's not easy to collect dry blood spots, but it's also not extremely difficult to think about doing that in low resource settings. One of the interesting challenges, and I'm sure people in their own work have found this, like we do a lot of work on air pollution in Africa, and it turns out that there's hardly any data for ambient air pollution across Africa, and whatever is there is at a very coarse scale. So I think bringing some of the exposure measures as appropriate, and air pollution is a good example of, to a more localized setting where we can say a little bit more about what's going on at finer scale. But that's where this issue of georeferencing, it just is so critical, because it's both a bottleneck in a lot of this type of work, because it's hard to put WRF chem climate models together with very fine scale, household level socioeconomic data. But that georeferencing gives us a sort of common thread throughout. So those are just a couple of examples of things, but this is really like the power of an interdisciplinary group, and the thinking about what's feasible in the settings that we're working in would be exciting to do.
Yeah.
I have a question on that, some of the challenges of interdisciplinary work, and maybe to Bronco's presentation, to where we've got different disciplines collecting data on exposure. You've got the sensors, the engineers collecting sensor data, the public health people collecting survey data, and the anthropologists collecting ethnography data. And I have been working with anthropologists quite a bit in Ecuador. And that one of the challenges that I'd like to hear your thoughts on it is the idea that these different disciplines collect data in different timescales. Anthropologists tend to like to be spending a year in a village before they can really talk about the nuances that are happening. Whereas, the sensors are collecting data, could be every second, every minute, and survey development and implementation somewhere in between. So these data are coming out at different timescales. And what have you noticed in your work in Mexico with regards to that?
Yeah, we're still, the temporal kind of alignment of these things is still kind of something that we're looking at, because it's for sure a challenge, right? Like at the most basic level, you can just kind of try to timestamp stuff and align it and hope to interpolate in between. But like there's like these questions you can answer live at different resolutions, right? So even though the water quality data might be able to answer something very specific about the water quality at an hour resolution, we might not be able to use that data to talk about public health until we sort of like average it into the timescales that the other data are being recorded at. But I would just, just being super frank, it's something that we're kind of like, not necessarily struggling, but we're discussing as a group. And the thing I've really enjoyed about this group in particular we're working on, it's been a very kind of honest discussion between everybody, but like, how is this all coming together? You're mentioning about anthropology. I'm used as an engineer to just numbers, and they make me feel comfortable. It's not like I don't like writing or anything, but numbers are a thing I can do something with. And the interviews, we trained our students, like our student Ernesto went out and did like ethnography, which was like new to me, but like he's the one who had to do it, right? And we learned so much from that. And like just going back to what you mentioned, like it's how we formulate problems too. I mean, like I learned, like it was this idea of, do we need a hypothesis to carry on? And I was like, what do you mean? Like, because anthropology, and I learned from Liz, like you go out and you discover things. And to me, it's like, well, no, I go check things. Like I have a thought about how it works and I go check it. But I will say that like there wasn't a right or wrong way. It was kind of fascinating to learn how other disciplines like think and do stuff. And I think we have to learn more about the data sets they collect to figure out how to put together. But I think there are tools. So I know this is a long-winded, perhaps, answer your question, but there are like formal methods, like mathematical ways of doing it. But I think we also have to figure out other ways of doing it. And that's kind of what we're kind of working on. I think it's kind of an open, frankly, on our problem right now, on our particular application, it's an open kind of frontier. So.
I'd like to follow up on that. And Marie, in particular, you mentioned the op-ed you read and the term capacity sharing. I wrote it in big letters on my paper. I really love that concept. And I think, Branko, your answer just kind of got to we think about capacity sharing kind of across spaces and institutions and countries and cultures. I think we're also talking about capacity sharing like within our disciplines and even within our own institution. So how do you see that? That's almost a mindset shift in how we interface with each other. And maybe you can speak to that a little bit. You've had quite a bit of experience doing this in a couple different communities now. I see people in public health in particular, health behavior, health education, having very significant experience in working in these ways. I know sitting in engineering as Branko does, and maybe there are other disciplines here as School of Environment and Sustainability also has people who do this, but we're trying to get into doing this kind of work and we don't have that capacity traditionally. So maybe the same could be said for some of our partners when we try to integrate health and environment in their space. How do you suggest we kind of move forward from the standpoint of the center to build this capability?
Yeah, that's a great question. I think the comments of my co-panelists were very thought-provoking. I mean, I think one thing I should mention is capacity sharing across disciplines that many of us have done. Pam gave the example of how in Africa, if you want to study air pollution, there aren't monitoring networks, but the global burden of disease efforts use satellite imagery to represent air pollution through the visibility. And I think there's quite a bit of work on, well, how do you ground truth that? How do you know that that's, actually representative of the air pollution in an area? And certainly, it often cannot capture that fine scale intra-urban variability. And I guess I would say from the perspective of collaborating with people who work, you know, with satellite images and sort of bringing that down to the level of, you know, what is, you know, how do you ground truth that with measurements made on the ground, and also how do you learn about people's lived experiences, perhaps through ethnographic approaches. You know, just because someone lives near a park or lives, you know, on a vegetated street doesn't mean that the benefits that we hypothesize from green space come to them, especially if there are barriers or other factors that prevent that. So I think that's one comment on capacity sharing across disciplines that I think really has enriched our work. And then the capacity sharing, I think, is partly, you know, I don't know exactly how the center will address this, but I think the idea of listening, you know, hearing from, maybe listening first to our colleagues in other countries about the problems they're facing, how they address it, and learning from those approaches, and really thinking about how the skills and resources that we may bring can help solve those problems. So that's an initial thought to address your point.
Thank you. Yeah, I appreciate that. I think there's a lot to do this, to do in this space. I think we have a question from Laura Rosick. So I think our people controlling this are going to pull up Laura so she can ask her question.
Oh, I wasn't expected to ask. I just typed it into the chat.
Yeah,
Hi, everyone. Hi, Nancy. I'm sitting here on my couch. No, so no, this has been so interesting. I really appreciated hearing all of it. It's just been fascinating, especially the study in Nepal, which I had no idea. But I have a broad question. You know, I work with this group a little bit in one of the mega cities in Southeast Asia, and they do a lot of work with air pollution monitoring. And they have a lot of political obstacles because the air pollution is so political there. And so they have a lot of obstacles working with the government, and, you know, even publishing data is difficult. And I'm wondering if any of you have encountered these, if there are strategies as you think about doing large scale monitoring, because I think it's a great idea. And I really love this surveillance idea.
Yeah.
But how you approach these kind of political difficulties across the world.
Let me start with Durga to go there, and then there may be other panelists who want to speak up.
Yeah, that's a big challenge, and yeah, World Bank and other institutions even call fragile state, where the uncertainty is very high. And we have been through armed conflict. The armed conflict was started in 1996. We started our project in 1995, and then we have been through that conflict, collecting data. We never stopped collecting the data, but it took a lot of work. There are a lot of stories I can share, but right now, given our time constraint, I would not go to the details. But the number one principle is neutrality between the warring party. Like, if you are neutral, if you can show them that your interest is only academic, and you do not side with either of the political parties or political groups, in that scenario, yeah, you can, and that can help. I don't say that will resolve the problem, but that will help. That's what we did in Nepal. Yes, we were in armed conflict. We collected data during armed conflict, and we have been through those challenges.
Thank you. Anybody else have something to add there? I think Rajiv, we don't know if you have a question or not. We saw you raise your hand. If you do, we can certainly give you the floor. But as you think about that, I guess I'll just say, Durga, that yeah, I've heard the same thing even in domestic, and I worked in Flint, and this was certainly complicated, but trying to maintain neutrality, I think, is kind of the out message that I think transcends location, perhaps. Thank you. Rajiv, I see you there. Why don't you go ahead and pose your question?
This has been a very interesting conversation. My question was pertaining to, so that there's not been a speaker on involved in disease surveillance, I guess, either locally or globally. And as one of those whose main research is in the area of disease surveillance, specifically kidney disease surveillance, recently we've become very interested in looking at a particular type of kidney disease that has become a global sort of affecting many countries around the equator. And it's emerged in the last 10 to 15 years, more so in the last, I guess, 2 decades, but has, and is increasing in severity, and mostly in Central American, Northern Africa, Southern India, and some Southeast Asian countries. And it's sort of been linked to some kind of environmental exposure related to agricultural profession, but also in large part due to heat stress. And increasing heat stress in these areas, particularly around the equator, and people have wondered whether this is a climate change associated, maybe not the proximate cause, but the underlying stimulus to sort of unmask this disease. I was wondering if one of the approaches could be to identify hotspots of emerging illnesses, let's say infectious, non-infectious, and then to explore which of these might be determined by environmental changes, and sort of in reverse almost, and then focus on those areas first, because otherwise this is a very large effort. Somebody's focusing on Nepal, somebody's focusing on Central America. It has to be really a global uniform effort of tracking all kinds of climate and environment, which is a huge exercise. So another way to do it, maybe to focus on emerging diseases or emerging health issues, since this is somewhat focused on health. So anyway, I'll stop because I
appreciate that. And I think that I'm thinking of both Pam and Marie, both have something maybe to say here. There may be others, but Pam, you talked about the non-communicable kind of growth in some of those diseases and trying to understand them. And there's been maybe less monitoring in that space. Maybe there are different ways to collect that kind of data to identify those hotspots. You want to say anything, Pam?
Yeah, I just want to maybe, so I guess one way to think about investing effort is to focus on places where there's high levels of climate vulnerability or environmental exposures. And then the other way, as you're suggesting, Rajiv, would be to focus on particular diseases and see if those can be linked to environmental exposures. But I feel like there should be some effort to sort of overlay those two things, because we sort of need action on both sides, right, to be able to tell a story. So I think it's a very important point you've made that there's this issue of disease surveillance. I have a colleague who works on gastrointestinal cancers, and they've also been on the very big rise in Central American communities, and the hypothesis is that it's related to household air pollution exposures, but hasn't been investigated extensively. So this idea of sort of overlapping these problems and trying to, so it's complicated, right? We have to overlap those problems, and then we have to find a place where there's good University of Michigan infrastructure and buy-in and willing partners who will collect transparent, robust data. But the world is a big place, and that location exists. But I think it's really interesting, especially to flag these sort of emerging things that we really don't know a lot about, and to think about, who we could play a part in putting those things on the map and building the evidence base.
And I think this is an excellent point, and I'll just emphasize that those decisions haven't been made in terms of focusing on a place or, but bringing forth the idea of disease surveillance as kind of an informative emphasis is something that I think deserves more discussion as we frame the center.
Yeah, I think just a few comments on the fact that, yeah, indeed, probably there is less attention paid to the disease part of this surveillance system. I think one of the ideas that we're thinking of is what is the essential maybe data that a framework should be collecting that could cross or move across many different kinds of research activities. This base surveillance system is not going to address everything, but then if it addresses a base foundation and the basis in which someone can come in with an interesting question and then leverage off of the base information and then add some additional data, I think that would be the power of this infrastructure. So that comes to the question, is there some base syndromic kinds of data that you might want to collect? I focus on infectious diseases, and we collect a lot of syndromic data centered around diarrheal diseases and arboviral diseases, and in fact, focusing on emerging infections in that arboviral space. And so in that area, there are base kinds of syndromic surveillance that you could use that you may be able to identify a spike in febrile illness or a spike in different kinds of symptoms of coughs or rashes. And so that is one of the challenges that we would address, is what are some of those basic syndromic aspects or dimensions that should be in a kind of a base infrastructural program.
No, thank you.
Yeah, thank you. Marie, go ahead.
Yeah, I just wanted to say thank you, Rajiv, for bringing that up, because I've read some about this. I think it's called Mesoamerican
right.
nephropathy, and it's affecting healthy young people in their 20s, and it's a chronic kidney disease, and so there's a real argument to be made that the public health impact of this and understanding, is it heat, is it pesticides, is it some combination thereof, and especially in these subtropical regions where pesticides may be regulated very differently. So I thank you for bringing that up, because I think it does it's food for thought about this center, and that perhaps that could be part of the, the thinking about priorities. Is there an emerging disease that's affecting a large number of people, and that maybe is not being studied in the way that it could, to lead to some solutions and prevention? So thank you.
Welcome.
Yes, thanks. So I think we're getting close here. Are there any other questions or comments that any of the panelists wanted to offer at this point, and that you feel may be a gap that you wanted to get across before we end? We've got about 5 more minutes or so.
I want to flag, and probably Joe can speak more eloquently to this, but we have a colleague who's now at Boston College, Gautam Yadama, and he does basically build systems dynamics models, which I think is something that a lot of us from our various disciplines can understand and get behind. So he works with systems modelers, but all of the inputs that they get, or a lot of the inputs they get for their models, come from sort of community level focus groups. Like, they have this really interesting iterative process where they're building the systems model, they're checking in with the people who are actually the subject or the system that's the subject of the model, and they're putting data in and continuously tweaking and calibrating those models. So I think and Joe, I think you mentioned this in your sort of slides up front, that there's sort of systems thinking is underlying a lot of what those of us who've been talking a lot about this effort could entail. And that's a potential way for bringing people from a lot of different disciplines into sort of a common sphere where they've got a language that they can use and a problem that they can focus on. So I just wanted to put that idea out there.
Yeah, I think that's a great point, and a great plug for the idea of a systems approach, in a way that, and in my experience working with systems models, I often have an easier time talking to social scientists, anthropologists, and qualitative researchers about a systems model, which really is a sort of a complex hypothesis of what you think is going on. And you really want to talk about some of the nuances in what you learn by these focus groups or doing ethnography, that you can put into this model, and really then use this model and use the data that you're collecting in the surveillance to like test whether or not this model is really capturing the phenomena that you wanted to capture or not. And so that's the really power of using this kind of systems approach, and realizing that, you know, it's again, not just a forward thinking, you know, exposure causes disease, but the disease can affect the exposure, and you get that feedback in there that really kind of adds to the nuances of what you're studying.
We just have a few minutes, and Pam, I actually have a question for you. That you talked about shocks and how people respond to shocks, and you didn't say it, but I think what you're saying in the words I use is like they build up a resilience or a knowledge base that is a result of how they respond, say, to a shock. I'd call it a perturbation or whatever. That then is a learned, acquired understanding, so that if that shock comes again, now they start at a higher place, perhaps, and respond more efficiently and in a more resilient way. And I work with people at Wayne State who are doing this in the domestic setting, thinking of places like, you know, what we learned at Katrina, or we're learning in Flint and other so forth. I'm thinking about how one then takes that knowledge cross culture, you know, and if in your work you've seen things that translate maybe across cultures that are kind of agnostic to the culture, that we can learn from shocks and building human resilience and how people respond, or some of those features, or do we not have a good handle on those commonalities, I suppose?
Yeah, I mean, from the work that we've done, what we see is what we would call social capital in the social science world, like these networks among people where they have the ability to communicate either that something is coming and so they need to take some sort of action, or they have the ability to, you know, borrow money or look to someone for some sort of support. So that certainly, I think, you know, is a sort of social structure that transcends
and so maybe
a lot of different systems.
Thinking about how the data surveillance system enables and enhances that kind of social capital and communication within those networks, potentially.
Yeah, I mean, it could be, I mean, if you think about like the demographic surveillance system that I know the best is the one that's in northern Malawi. It's been running for about 20 years, and now everyone has a cell phone. So if something really bad is going to happen, there's a way to communicate that to at least the people that are operating within that system. And there are a lot of them now because, you know, the thing has grown over the years.
Yeah.
So
great. Yeah, I think there's a lot for us to tag onto there. Well, we are at time. It's 6:28. So I'm going to thank all our panelists. This was really a great discussion, and I think a lot of food for thought. Thank you, Pam, Marie, Bronco, Durga. Really appreciate that. Thanks for the audience who came and listened and asked questions, for giving your time tonight. And so on behalf of the Center for Global Health Equity, I wish everyone peace and health during the holiday season, and we look forward to engaging with you further in the new year. Good night.